SYRI, a do-it-yourself practice model for lacrimal syringing. With the increasing backlog of cataract surgery in India, each year around 2 million cataract operations are done throughout the country. The presence of ipsilateral nasolacrimal duct obstruction is considered an important risk factor for endophthalmitis following intraocular surgery. Hence, the NLD screening prior to cataract surgery is of paramount importance. Though pressure over lacrimal sac is an important screening tool to rule out an overt NLDO, lacrimal syringing is by far the most effective method to check the nasolacrimal passage for any obstruction. It is also used to flush out any debris in the lacrimal passage, used for administration of antibiotics, and introducing dye in an X-ray procedure. Let's see how syringing is done. To start, we prepare a 2 ml syringe with distilled water and then attach a 27 gauge cannula. After numbing the eyes with anesthetic drop, we evert the lower lid to expose the lower punctum. By inserting the cannula into the punctum, we navigate it through canaliculus and water is injected. The patient's response is recorded. If the nasolacrimal duct is open, the water will flow into the nose and throat, prompting the patient to swallow. And if there is a block, the fluid will return to the eye of the patient. However, lacrimal syringing is an invasive procedure. It requires smooth skills and precision to avoid any iatrogenic injury to the delicate lacrimal drainage system. So our aim was to mimic the lacrimal drainage pathway of human and build a practice model of syringing, including a do-it-yourself inner functional part replicating the lacrimal drainage system and an outer mechanical part mold for realistic feel of skin during the procedure. The DIY model is made using an ink dropper which replicates the lacrimal sac, a silicone tubing which corresponds to the NLD and the canaliculi. 2 circular apertures are made in the ink dropper and 2 silicone tubings of length of 10 mm are attached to the aperture, followed by making bends in the tubing using pins and the super glue. It replicates the 2 mm vertical and 8 mm horizontal canalicular part. We searched for a few compatible materials that would mimic the nasolacrimal duct system. This included coffee stirrers, capillary glass tube used by pathologists, steel pipe, or a wooden hollow tube. But none of these had similar attributes to the functioning nasolacrimal system. At last, the silicone tube used in Simcoe cannula during irrigation and aspiration in cataract surgery was used. This had similar elasticity and also had realistic feel for performing and learning the procedure of syringing. We decided to use silicone to create the eyelids and the outer structure of the upper quadrant of face, for which the 3D mold was printed. The silicone rubber liquid is poured into the 3D mold with DIY model kept inside, and the mold is left for 3 to 4 hours for setting and drying. 3 models are adequate to understand the basics of lacrimal syringing. If the dye is passed through one of the tubings and fluid drains through the nasolacrimal pathway and exits the nose, it would be considered as normal. If the dye regurgitates through the same tubing, it would be considered a same canalicular block. If the dye regurgitates through the opposite tubing, it would either represent a common canalicular block or the NLD obstruction. Our DIY SYRInging model not only shortens the learning curve of lacrimal SYRInging, it also helps in interpretation of various lacrimal passage obstruction in a simple manner. Our model is easily accessible, made from commonly found materials, and can be used from a small eye care clinic to a tertiary eye care center. It is highly cost effective, with each model costing less than $1. The model effectively demonstrates the anatomy of nasolacrimal drainage system, but it does have its notable limitations. Specifically, the absence of eyelid margin prevents the localization of stenotic punctum or the use of a punctum dilator. Additionally, the model cannot replicate the lateral pulling of eyelid, which is crucial for orientation of the vertical and the horizontal portion of canaliculi during probing and SYRInging in a clinical setting. While this model isn't designed for teaching probing techniques, it provides valuable insights into various canalicular and nasolacrimal blocks. Therefore, repeated practice with this model enhances the proficiency in performing SYRInging procedure, leading to a more effective patient care. Further refining and upgrading this practice model may allow its possibility to demonstrate and teach complex surgeries like DCR and DCT. Hence, we recommend eye clinics to utilize this newly designed practice model for the safety of our patients and better understanding of nasolacrimal drainage system.